CSF cisterns. This will be the first lecture in English language. This lecture I have published 13 years ago. It has achieved 100,000 views on a SlideShare. It's an important lecture. What is the meaning of cistern? Cistern means widening of the subarachnoid space created by separation of pia and arachnoid. These are the three layers of the brain meninges: dura, outer layer, which is adherent to the skull; pia, most inner layer, which is adherent to the brain surface; and arachnoid covers only superficial surface of the brain, does not enter into the enfoldings of the brain. The coronal diagram showing the layers of the meninges and the skull. It's a skull, outer table, inner table, diploid space. Dura, which is outer layer, is split to contain the dural sinuses, followed by the arachnoid, which is in orange color. The pia in white color follows the enfoldings of the brain through the sulci and the gyri, while the subarachnoid space is the space between arachnoid and pia. This space can be narrow in front of the gyri, and it can be deep in front of the sulci or any enfolding of the brain. These are 3D diagrams showing also the layers of the meninges: skull, periosteal layer, skull, outer table, inner table, diploid space. The dura has two layers: outer layer or periosteal layer, deep layer or dura proper. These two layers are split to contain the dural sinuses, followed by the arachnoid layer, and pia, which covers the surfaces of the brain. There are spaces between the meninges. The first space is a subdural space. It is a potential space, not actual space, only expanded, which contains fluid like subdural hematoma. Second space is subarachnoid space, which contains fine arachnoid membrane and contains blood vessels, whether arteries or veins. A sagittal diagram showing the cisterns in the midline. Only midline cisterns can be viewed in this image. We can arrange it in clockwise manner. Cistern anterior to the medulla is called the medullar cistern or premedullary cistern. Cistern anterior to the pons called the pontine cistern or prepontine cistern. Cistern anterior to the midbrain is called interpeduncular cistern because it is between the cerebral peduncles. Chiasmatic cistern or supracerebral cistern superior to the pituitary gland and contains the optic chiasm. Lamina terminalis cistern is anterior to the anterior wall of third ventricle. The anterior wall of third ventricle is called lamina terminalis. That is why the cistern anterior to the lamina terminalis is called lamina terminalis cistern. Pericallosal cistern surrounding the corpus callosum. Superior cerebellar cistern is superior to the cerebellar vermis, quadrigeminal cistern, posterior to the quadrigeminal plate midbrain. Cerebellomedullary cistern or cisterna magna between the medulla, posterior surface of the medulla and the inferior vermis. Lastly, velum interpostum cistern is a tongue-like projection from the quadrigeminal cistern. It is a blind end cistern superior to the roof of the third ventricle. We can classify these cisterns by this line into supratentorial and infratentorial cisterns. Sagittal T2 image in midline showing also midline cisterns, premedullar cistern or medullary anterior to the medulla, pontine cistern anterior to the bone, interpeduncular cistern anterior to the midbrain, suprasellar cistern superior to the pituitary gland, pericallosal cistern surrounding the corpus callosum, superior cerebellar cistern superior to the cerebellar vermis, quadrigeminal cistern posterior to the quadrigeminal plate, and the velum interpostum cistern that contains the intercerebral vein, that contains the internal cerebral vein. Lastly, cisterna magna or posterior cerebellomedullary cistern between the medulla and the cerebellar inferior vermis. The same image, but in T1, medullary cistern, pontine cistern, interpeduncular cistern, suprasellar cistern or chiasmatic cistern, laminoterminal cistern, pericardial cistern, quadrigeminal cistern, superocerebellar cistern, cisterna magna. The best classification of CSF system is supratentorial and infratentorial system. These are the supratentorial system, anterior, lateral, posterior, or superior system. These are infratentorial system. We will discuss every one separately. This is a collection of systems surrounding the midbrain and takes the name of perimesencephalic system. Peri means surrounding, mesencephalic means the midbrain. These are 4 systems. The first one is the interpeduncular system, then because it is between the cerebral peduncles, followed by the crural system, which is anterior to the crus cerebri, another name of the cerebral peduncle, ambient system, which is a lateral extension from the quadrigeminal system surrounding the midbrain. That is why it is called ambient. Ambient means surrounding, and last quadrigeminal system is the posterior to the quadrigeminal plane. These are the CSF systems, median unpaired systems. Every system in midline is single or paramedian pair systems. These are double systems, one on the right and the other on the left. First system we'll discuss is the premedullary system or medullary system. It is anterior to the medulla. It contains the vertebral artery, pica or posterior inferior cerebellar artery, and hypoglossal nerve. We'll discuss this anatomy in brief. This is the closed medulla. These are 2 vertebral arteries, and this is hypoglossal nerve direct to the hypoglossal canal, and this is the lobe of pica or posterior inferior cerebellar artery. This is angiography showing the vertebral system. These are 2 vertebral arteries. This is the pica with its lobes, basilar artery, and 2 posterior cerebellar arteries. So the premedullary system contains vertebral artery, hypoglossal nerve, and posterior inferior cerebellar artery. Another diagram showing the premedullary system. Another diagram, this is the level of premedullary system, especially one showing the premedullary system and axial CT. Okay. Second system is the premontine system anterior to the bones. It contains the basilar artery and the ica, which is a branch of basilar artery, anterior pontomesencephalic vein, and 2 cranial nerves. Cranial nerve number 5, cranial nerve number 6, cranial number 5, trigeminal, and abducent nerve. This is stage 31 showing the prepontine system. This is the level of the prepontine system axial CT showing the basilar artery, pontomesencephalic vein adjacent to the basilar artery into the anterior into the prepontine system. This is the trigeminal nerve directed toward the Meninges cave. It is also located in the prepontine system. This is the second cranial nerve located in the prepontine system. Is the abducent nerve or sixth cranial nerve. It is located at the pontomedullary junction, at the level of pontomedullary junction. This is the ica, a branch from the basilar artery. It gives the lambricine artery. The sixth cranial nerve crosses the prepontine system to enter the Dorello canal. Is a small canal into the skull base before it enters the Meninges cave. Sometimes it is affected by arachnoid cyst. This is prepontine system expanded by arachnoid cyst, so it's called prepontine arachnoid cyst. The third system is an interpeduncular system between the 2 cerebral peduncles. It contains the basilar tip, superior cerebellar artery, posterior cerebral artery, interpeduncular vein, and third cranial nerve. The level of the interpeduncular system anterior to the mesencephalic tegmentum. This is the axial CT showing the interpeduncular cistern between the two cerebral peduncles and anterior to the tegment. The interpeduncular cistern it contains the third cranial nerve. This is the third cranial nerve surrounded by a small cistern before it enters the cavernous sinus. Basilar tip. Now the basilar tip is below this level and bifurcated into two posterior cerebral arteries. When you find the hyperdense rounded lesion in the interpeduncular cistern, we know by anatomy it is the basilar tip. So easily it is the basilar tip aneurysm. Hyperdense CT signal void rounded lesion on MRI. The venous veins that located in the interpeduncular cistern, called the interpeduncular vein, which receives the blood from the middle cerebral vein, deep middle cerebral vein, and the basal vein of the cistern. The next cistern is a chiasmatic cistern or suprasellar cistern. It contains the optic chiasm and pituitary infundibulum superior to the pituitary gland. Sometimes it is expanded by arachnoid cyst, so it's called suprasellar arachnoid cyst. Laminar terminalis cistern we have told before. It is anterior to the laminar terminalis, which is the anterior wall of the third ventricle. It contains the anterior communicating artery and the anterior cerebral artery. This is a surgical diagram showing the anterior wall of the third ventricle and the laminar terminalis, which is called laminar terminalis, and laminar terminalis cistern is located here. Okay, we have to know this diagram in detail. This is brainstem, pontine belly, membrane tegmentum, tectum. Okay, this is the floor of third ventricle, mammillary body, tuberositarium, infundibulum, optic chiasm, laminar terminalis, anterior commissure. Okay, and this is the posterior commissure. Sagittal closed sagittal MRI image for the third ventricle. To know the anatomy, we have to know this area in detail. This is the brainstem, bones, the tegmentum of membrane, tectum, mammillary body, tuberositarium, infundibulum, pituitary gland, optic chiasm, laminar terminalis, and this is laminar terminalis cistern, anterior commissure, massa intermedia between the two salami, posterior commissure. When you find a rounded enhancing structure in the laminar terminalis cistern, we know by anatomy this cistern contains the anterior cerebral artery and the anterior communicating artery. This is easily anterior communicating artery aneurysm. Pericallosal cistern, which is surrounding the corpus callosum, between the corpus callosum and the cingulate gyri. This cistern contains the pericallosal arteries, which are branches of one of the two terminal branches of the anterior cerebral artery. When you find the rounded lesion in the pericallosal cistern, which is hypertension in CT, signal void in MRI, this is easily pericallosal artery aneurysm. When you find the subarachnoid hemorrhage in the pericallosal cistern and the laminar terminalis cistern, you have to suspect bleeding anterior communicative artery aneurysm. Quadrigeminal cistern. Now we are in the posterior cistern. Quadrigeminal cistern is posterior to the quadrigeminal plate. It contains the vein of Galen, precentral vein, and P3 of posterior cerebral artery, third part of the posterior cerebral artery. When you find a rounded lesion of signal void in the quadrigeminal cistern, you can easily diagnose vein of Galen aneurysm. Procentral vein is the deep venous drainage of the posterior fossa. If there is any posterior fossa AV malformation, it will be drained by this vein. Precentral vein, mean venous drainage of the posterior fossa. It is like the internal cerebral vein or the supratentoric. Sometimes it is expanded by arachnoid cyst, called quadrigeminal plate cyst or epidermoid cyst. A second posterior cistern is superior cerebellar cistern, superior to the cerebellar vermis. It contains superior cerebellar artery and some superior cerebellar vein. It can be expanded also by arachnoid. Vela metalbostum cistern. You have to understand this cistern deeply. It is located superior to the roof of third ventricle. This is the coronal anatomy of the cistern. It is located superior to the roof of third ventricle and inferior to the crura of the fornix. It contains the two internal cerebral veins. This cistern differs than any other cistern by two things. First, it is a blind-ended cistern, open from one side and closed from the other. Another thing, it is lined by pia mater from both surfaces. Every cistern is covered by dura from one side or arachnoid from one side and pia from the other side. But this cistern have two layers of pia mater. Sometimes it is expanded by cystic lesion, then it is called cavum belli interposti. The difference between cavum belli interposti and cavum septum ballostum and cavum fergi, cavum septum ballosti is triangular in shape, while cavum septum ballostum and cavum fergi are flask shaped. Another cistern in the midline is the cisterna magna because it is the largest cistern. It is located between the medulla and cerebellum inferior vertex. These are dural folds. These are dural folds inside the cisterna magna, which differentiates between megacisterna magna and posterior fossa arachnoid. Pellicula cerebelli is a cerebellar cistern between, or CSF cistern between the cerebellar tonsils. It connects between the cisterna magna and fourth ventricle. Posterior cisterna magna, anterior fourth ventricle, and cerebellar tonsils on both sides. It contains lobing of a pipe. Sorry. Sometimes the pellicula cerebelli is dilated in Dandy-Walker malformation. The first paired cistern we described, it is the CD angle cistern. It is located anterior to the CD angle. It is divided into parts: superior CD angle cistern and inferior CD angle cistern. The superior CD angle cistern contains ICA and the 7th and 8th cranial nerve, while the inferior CD angle cistern contains the 9th glossopharyngeal and the 10th vagus nerve. These are different lobing of ICA surrounding the 7th and the 8th cranial nerve. Sometimes the lobe is in the CD angle cistern, and sometimes it is inside the internal auditory canal. Inferior CD angle cistern contains this 9th and 10th cranial nerves. Sometimes it is expanded by cystic lesions, maybe arachnoids, maybe epidermolysis. Crural cisterns, which are the cistern anterior to the crus cerebri, another name of the cerebral peduncle. It contains a P2 segment of posterior cerebral artery, superior cerebral artery, and the anterior choroidal artery. It is located anterior to the crus cerebri and posterior to the uncus of medial temporal. As I told you, it contains some these arteries and basal vein of the cell. This is CT angiography showing the posterior cerebral artery coursing in the crural cistern. This anterior choroidal artery branch from posterior surface of internal carotid artery as it courses through the crural cistern between the cerebral peduncle or crus cerebri and medial temporal loop or uncus of medial temporal loop size. This is the ambient cistern, a lateral extension from the quadrigeminal cistern surrounding the midbrain. It contains trochlear nerve. The trochlear nerve is the only nerve that exits the brainstem from its posterior surface, and the only nerve crosses to the opposite side. These are the basal veins of the cell as they draining into the vein of Cannes. They also course into the crural cistern and ambient cistern. Sometimes it is expanded by the dermoid cyst. If you have find an enhancing lesion in the ambient cistern, you should suspect trochlear nerve schwannoma or fourth cranial nerve schwannoma, specifically if there is the atrophy of the superior oblique muscle. Retrothalamic cistern or wings of ambient cistern. These are lateral extension of ambient cistern between posterior to the thalamic bulbinare. It contains the lateral posterior choroidal artery. This is the retrothalamic cistern. It's expanded only if the brain is atrophied. This image we always find in TT. We have to describe it. Anterior vellum interpostum cistern, posterior superior cerebellar cistern, and the lateral retrothalamic cistern on both sides. This is calcified by nail pulp. We have ended the anatomy of CSF cistern. This is a brief view on pathology of CSF spaces. The first image, the ventricular system is not dilated and subarachnoid spaces is not dilated, and this is the normal CSF appearance. The second line, the ventricular system is dilated and the subarachnoid spaces are dilated. This is brain atrophy. The third line, the ventricular system dilated and subarachnoid spaces effaced. In the case of hydrocephalus. The fourth line, the ventricular system is effaced and subarachnoid spaces are effaced, and this is brain edema. These are the four most common possibilities of subarachnoid space and ventricular system space. Again, the ventricular system not dilated, not effaced. The subarachnoid spaces are not dilated or effaced because this is the normal finding. The ventricular system dilated and subarachnoid spaces are dilated. This is brain atrophy. The ventricular system dilated and subarachnoid spaces are effaced. This is hydrocephalus. The ventricular system effaced and subarachnoid spaces are effaced. This is brain edema. Normal, atrophy, hydrocephalus, and edema. In this case, the child, we have find the subarachnoid spaces are dilated and the ventricular system is dilated. But by previous rule, this child should have brain atrophy. But we can find here the child have larger skull with craniofacial disproportion. This is called the benign external hydrocephalus or benign enlargement of subarachnoid spaces in infancy. By follow-up, this subarachnoid spaces will become normal about after 2 or 3 years. The cause of benign external hydrocephalus or benign enlargement of the subarachnoid spaces in infancy, immature arachnoid granulation. Clinical picture, macrocephaly and normal developmental milestones. Sometimes there is a motor delay, but every other milestone will be normal. These are findings of benign enlargement of subarachnoid spaces in infancy. This is a case of benign enlargement of subarachnoid spaces in infancy. The interhemispheric fissure is widened more than 5 millimeters. The widening of the subarachnoid spaces is more anteriorly than posteriorly. There is no associated significant mass effect. If you give an IV contrast, you can find the subarachnoid vessels are coursing in this space freely, as in this case. How to differentiate between benign enlargement of subarachnoid spaces in infancy or external hydrocephalus and subdural hematoma or hygroma. In this case, you can find the blood vessels coursing freely in subarachnoid space, while in subdural hygroma or hematoma, you can find these subarachnoid blood vessels coursing freely all blood vessels will be compressed against the surface of the brain. How to differentiate between hydrocephalus and atrophy? In adult, it will be easily, as we described before. In adult, the ventricular system is dilated and subarachnoid spaces are effaced, but in the children, this rule is not always followed. Sometimes the ventricular system dilated and subarachnoid spaces are dilated, and the patient has hydrocephalus. How to differentiate? The first important image is sagittal image. You can find the widening of the anterior recess of third ventricle, depression of the floor of third ventricle. Normally, it should be concave, but it is convex, and there is the narrowing of the mamellopontine distance. Normally, the mamellopontine distance is equal to the mamello anterior commissure distance, but this case the ratio is much increased. The case of dilated ventricular system, while the subarachnoid spaces are not much effaced. As in this case, the ventricular system is dilated. I can't know if it is atrophy or hydrocephalus, but in such an image, we can find the mamellopontine and the mamellocommisural distances are not equal. The mamellocommisural distance is much increased, and this is a case of hydrocephalus. Another case, another differential diagnosis in between hydrocephalus is surrounded by interstitial edema, while atrophy is always surrounded by periventricular arteriosclerotic leukoencephalopathy. This is regular, thin and smooth, while this is irregular and of uneven thickness. Another thing is you should differentiate between hydrocephalus and periventricular leukomalacia. The ventricular system is dilated in periventricular leukomalacia, but it is irregular dilatation. And you can find that the amount of white matter surrounding with the ventricular system is much reduced. Thank you.